Hello everyone, welcome back to my channel. So today I will be presenting slides for the topic tongue for head and neck anatomy series. So let's get started. This slide represents the intrinsic muscles of the tongue. There are four paired intrinsic muscle of the tongue. It is called intrinsic muscle because the origin and the insertion both are into the tongue. Four intrinsic muscles: superior longitudinal, inferior longitudinal, vertical, and transverse. Now they are named according to the direction in which they run. And another thing, intrinsic muscles are responsible for affecting the shape and size of the tongue. So if we talk about the longitudinal muscles shortens the tongue. So this transverse and vertical, the name is transverse, but it has an opposite action. It elongates the tongue. And vertical is, we always think like vertical elongation, but no, vertical is will broaden and flatten the tongue. And now, affecting the shape and size of the tongue, their function is in speech, swallowing, and eating, right? The motor innervation of this intrinsic muscle is hypoglossal nerve. Okay, that is our 12th cranial nerve. Okay, so this slide is about extrinsic muscle. So now extrinsic muscle originates from outside the tongue. So any structure outside the tongue, but they insert onto the tongue. Extrinsic muscles are innervated by hypoglossal nerve. Intrinsic was also hypoglossal nerve. Extrinsics are also hypoglossal nerve, except palatoglossus muscle, which is innervated by vagus. Okay, so there are four extrinsic muscles: genioglossus, hyoglossus, styloglossus, palatoglossus. So let's go to individual extrinsic muscle. The first one is genioglossus. So genioglossus muscle is a very thick muscle which we can see in the diagram, the blue one. It's almost like a fan shaped muscle. It starts from the genial tubercle. The name itself says genioglossus. So it starts from genial tubercle and inserts onto the body of hyoid bone, and it takes up the entire length of the tongue. And that's why its name is genioglossus. Okay, so the function of genioglossus, it is protrusion. That is, whenever we take a selfie, right, we just try to take our tongue out sometimes. So remember, that is our genioglossus muscle which is acting. Okay, and innervation is hypoglossal nerve. So let's explore the styloglossus muscle. So styloglossus is a paired muscle. It is located on either side of the oropharynx. The name itself says styloglossus starts from styloid process and inserts on the side of the tongue. Action of this muscle is it pulls the tongue up, elevates the tongue so that it facilitates in swallowing, and also it retracts the tongue. The innervation is same, hypoglossal nerve. Okay, so let's discuss this beautiful muscle, which is a palatoglossus muscle. The name itself says palatoglossus, means there is a connection. This muscle helps in connecting the soft palate and the tongue. Now, this muscle originates from the palatine aponeurosis. Palatine aponeurosis is a connective tissue of the soft palate, and it inserts into the tongue. Now this muscle, what it does is it elevates only the posterior part of the tongue. P for palatoglossus, P for posterior part of tongue. So it elevates the posterior part of the tongue. Because of that elevation, it closes off the oral cavity from pharynx whenever swallowing takes place. Okay, So that is how it functions. It is innervated by the vagus nerve. All other muscles of tongue is innervated by hypoglossal nerve except palatoglossus, which is by the 10th cranial nerve, that is the vagus nerve. In more detail we can say pharyngeal plexus of vagus nerve. Okay, so last one is the hyoglossus muscle. The name itself says origin from the hyoid bone, insertion again side of the tongue. This is medial to the styloglossus. Okay, the styloglossus is more lateral, hyoglossus is medial. Function, it depresses the tongue, right? Because hyoid bone is down, right? Tongue is above. So the function of this muscle is it depresses the tongue and pulls the down side of the tongue downwards. It is also supplied by the hypoglossal nerve. Okay, so this slide is basically the summary of all the slides which we went through till now. So maybe you can just pause the video and do this slide by yourself. Inferior surface of the tongue. Now the first thing, when we elevate the tongue, we can see on the inferior surface the vertical fold in the midline, that is lingual frenulum. Then on the lateral side of this frenulum, both the side we have fold of mucous membrane, which is plica fimbriata. Now there is one more third thing which is called as lingua plicata, and that is fissured tongue. So there are three terms. First is lingual frenulum, which is the vertical fold in the midline. The second is plica fimbriata, which is lateral to this lingual frenulum. And the third is lingua plicata, which is fissured tongue. Orthin's duct is an opening of submandibular gland. And if we talk about sublingual gland, there are two things. If there are many small numerous gland duct, they are called as Rivian's duct. Or if there is only single large thick sublingual gland duct, that is Bartholin's duct, and that joins the Worthin's duct near the sublingual caruncle. Okay, so Rivian and Bartholin, they are both sublingual gland duct, while Worthin's is submandibular gland duct. Talking about the papillas of the tongue, the first one is the filiform papilla. They are the most numerous one, but they are avascular and they do not contain any taste bud. Okay, and this one gives the rough texture of the tongue. Now second is the fungiform papilla. Fungi, right, the name shows that is a mushroom shaped. Okay, so fungiform is mushroom shaped and they are scattered among the filiform papilla. They contain taste bud. Third one, the circumvallate papilla. Now these are usually 7 to 9 or maybe 12. They are large, they are circular, and they do contain taste bud. So there are von Ebner's gland, which are serous gland, salivary gland located within it. The fourth one is the foliate papilla. Now the foliate are located on the lateral surface of the tongue. Okay, they are rudimentary, they are non-functional, and they may mimic squamous cell carcinoma of the lateral surface of tongue when they are very much elongated or very much pronounced. So talking about the nerve supply of the tongue, the posterior 1/3 is very easy. It's just that general sensation, the taste sensation, everything is supplied by the glossopharyngeal nerve, that is the 9th cranial nerve. If we talk about the anterior 2/3 of the tongue, the general sensation of anterior 2/3 of tongue is supplied by the lingual branch of mandibular nerve, which is a branch of trigeminal nerve. However, the taste sensation is supplied from the facial nerve, that is the 7th cranial nerve. From this slide, the most important thing to remember is whenever there is damage to the right or the left hypoglossal nerve, that is the 12th cranial nerve, the tongue will always deviate to that side of the lesion. Damage to the right hypoglossal nerve, tongue will deviate to the right side. Damage to the left hypoglossal nerve, the tongue will deviate to the left side. Okay, so it is on the same side of the lesion. The tongue is derived from the first 4 pharyngeal arches. And so the innervation is also from all the first four pharyngeal arches nerves. That is the first arch, which is the trigeminal nerve, the second arch, which is the facial nerve, the third, which is the glossopharyngeal, and the fourth arch, which is vagus. How vagus? Vagus supply the epiglottis, which is on the posterior side of the tongue. So therefore, the fourth arch also, that is the vagus nerve. Well, I don't think that we need to go into depth about the brainstem nucleus and the thalamic nucleus. However, if you want, you can just have a read because they are all the same. So talking about the blood supply, the main supply is from the lingual artery. This is a branch of external carotid artery. Also, it gets supplied by the tonsillar branch of facial artery. So this we need to remember that the tongue is supplied by lingual artery and the tonsillar branch of facial artery. Okay. The venous drainage is by the lingual vein, and this lingual vein then empty into the internal jugular vein. Okay, so if we talk about arterial supply, it is external carotid artery. If we talk about venous drainage, it is into the internal jugular vein. Talking about the lymphatic drainage, anterior two-thirds of the tongue first drains into the submental and the submandibular, and then it goes into the deep cervical lymph node. However, the posterior third, it directly drains into the deep cervical lymph node. Okay. So yeah, that's all about the tongue. I think that is sufficient for the topic tongue. However, I'm just planning to include some questions if possible in the next video. Okay, so thank you so much for watching this video, and do let me know if you want any particular topic or any particular thing you want me to make video about. Thank you again. Bye.